I am Dr. Melissa King. I'm from Colorado State University. I'm an associate professor there in the equine sports medicine department, and I run the equine rehab center. Yeah, my first exposure was probably 3 years ago when I think Dr. Burka reached out to my colleague, Dr. David Frisbee, who's an orthopedic surgeon, equine orthopedic surgeon, and he said, I don't know anything about rehabilitation modalities. You need to talk to Melissa. And so we set up at a meeting at the Equine Orthopedic Research Center at CSU, and there kind of tossed around some ideas and some thoughts, and that's where I learned about the technology and then kind of expanded from there about what could we do, how could we make a research study to give you proof of concept, to give some evidence-based support to the therapy. The application of the BEMER blanket to horses with naturally occurring back pain, thoracolumbar epaxial muscle pain, in which we looked at a ton of outcome parameters, but we saw significant improvements in pain modulation, which we measured objectively. So we use an objective tool called the pressure algometer, which measures mechanical nociceptive threshold. So we saw objective improvements in pain. We did kinematics to look at spinal flexibility. So we saw improvements in thoracolumbar lifting and lateral bending. And then we measured their ability to stand balance. And we saw significant improvements in their neuromotor control following BEMER therapy. I frequently actually recommend BEMER therapy to both clients and colleagues because now we have some evidence-based support behind it, and that's where we struggle with a lot of these considered rehab modalities, right? Is sure, subjectively we get reports from the field that our clients are using them, that subjectively there's improvements, which there's value to that, right? But until you put the science behind it, it's hard for an equine professional to say with confidence, here's this device, go out and use it. And now we can say with confidence, there is significant beneficial effects in multiple arenas, right? Pain, neuromotor control, spinal flexibility, and so there's a whole host of beneficial effects. I have a lot of clients that come in and see it being used in my rehab center and then go out and say, where can I get one of those? Because they can appreciate while the horse is at the rehab center all the benefits that the horse is going through, and so they oftentimes will ask me, where do I get one? How do I get one? And then they go on it and get one so that when the horse goes home, it transitions from the barn, from the rehab center to an at-home program. Yeah, so for me, when you look at morbidities that horses develop, right? And so most of the time as a veterinarian, a sports medicine veterinarian, we're dealing with distal limb, right? But there's a host of comorbidities that the horses develop as a result of the distal limb injury. Most frequently, they develop back pain as sort of a compensatory shift to unload the limb. And so in my hands in the rehab center, the BEMER blanket is fantastic for those secondary comorbidities of back pain that the horses develop. So almost all of my horses in the rehab center have the blanket on.